Since becoming a member of the state legislature, I think my service on the Assembly Health Committee, but primarily my service as chair of the Budget Subcommittee on Health and Human Services, I think is really where I've spent a great deal of time over the past 18 months, focusing on protecting access to publicly funded health care services in California. I think the primary issues confronting Medi-Cal in California is the fact that California is broke. Looking at the last about 10 years of efforts of the legislature and the administration to balance an unbalanceable budget, and the areas that have taken a major hit, and Medi-Cal is one of those areas. So I think the primary issue is years and years of compounded impact of budget cuts that have impacted the kind of core infrastructure of the Medi-Cal program. The provider community has experienced multiple years of rate reduction that, from my perspective, impacts access to care, because it's almost not a wise business decision for a healthcare provider to be a Medi-Cal provider, just given the reduction in the reimbursement rates. On the beneficiary side, just the reduction of services, from dental services to the actions we took last March, limiting the number of visits to your Medi-Cal provider, are just two examples of major cuts that the program has suffered in recent history. As reflected in the Medi-Cal beneficiary survey, respondents expressed concern about their ability to access, particularly in a timely manner, specialty care. And so it's my hope with the full implementation of ACA here in California that Medi-Cal will be reinforced and shored up, if you will, in terms of expanding the Medi-Cal provider network to include, of course, the ever-needed primary care physician, as well as all the specialty docs that beneficiaries require. I think setting very public goals, creating a dashboard that measures success will help all of us with oversight, the legislature, the Director of Department of Health Services, the administration, the Health Benefits Exchange Board, everyone to have really a clear idea about the efficiency, the efficacy of the program. Again, really working towards creating healthier Californians, not looking at Medi-Cal as a program that people utilize when they're sick, but to really kind of flip that and recognize that increased access to preventive health services, which low-income and formerly uninsured people will do when they have coverage, really creates a healthier, more sustainable state, and really in the long run will be much more cost-effective for us to operate. And so I think the incredible opportunity we have here in California is to recognize the benefit ACA brings to us. It creates an opportunity where we can streamline eligibility, streamline the enrollment process, and make it easier for families who are eligible to remain in the program. You know, when you go back to the days of the quarterly status report and all the barriers we erect for families to really make it difficult to get services that they need, I'm looking forward to the benefits of ACA in streamlining that process and make it easier to get into care and stay in care. It has always been a wonderfully rich benefit package that is, kind of suffered a black eye as we talk about, the core value issue of who's entitled to health, those who can afford it or every Californian. And so I'm thrilled that Medi-Cal will have the opportunity to get much more significant support and be a part of a much more global effort to expand healthcare services to every Californian, because I ultimately believe that it really is a fundamental right.